This is Health Check on GH Today. My name is Nanama Anna Bempong, and today is for you athletes. We're going to be speaking with Dr. Michael Yanka from the Nova Wellness Center about athletic injuries. Stay tuned, we'll be right back. Dr. Michael, you are welcome to Health Check.
Thank you.
Thank you too. So, can you give us an idea of the different types of injuries that athletes can encounter?
Right. Whether you're a professional athlete or well-trained athlete, there'll be some day that you will encounter an injury. And when that happens, it becomes very difficult to know how to treat it. So, for example, some of the injuries that athletes usually get are the hip flexors strain. We have the anterior cruciate ligament sprain. We're talking about the groin pull, the hamstring strain. You can also get the patellar-femoral syndrome. When it comes to the shoulder, it covers a variety or a wide range of sports injuries, which ranges from dislocations, misalignment, muscle strains, and then ligament sprains. Okay. We also have what we call the sciatica, which is also part of the injuries that athletes can get.
Okay, we spoke about that. That's the lower back.
Yes.
Okay.
So they have it with pain radiating through the legs and other stuff.
Okay. So I think today we will focus on the shoulder and the knee pains. I think those are the most common injuries that athletes can have, if I'm not wrong.
That's right. That's okay.
So tell us a bit about what you would do if somebody came in with a shoulder pain.
Okay, so when someone comes in with a shoulder pain, what we normally do is that we first of all go through the chiropractic adjustment, which is the core of the treatment. And then after that, we look at the shoulder and then we do what we call the taping. Now, we use what we call the kinesio tape, which is an elastic therapeutic tape. It's a cotton strip with an acrylic adhesive, and it enables patient to get better quickly as well. So this kind of tape can be used with the intent of treating people with disability from athletic injuries and other physical disorders.
Okay. So how do you use it? Can you explain it a little?
Okay, so we first of all check where the patient has got the pain, and then looking at the muscle fibers, they normally go horizontally. So we put across the fibers, and then we put it on the other side to stretch it so that it stays adhesive for a while. And what it does is that the tape speeds up the healing process by lifting the skin away from the sore or where the tissue, the injured tissue is, thereby enabling blood flow and lymphatic drainage. So this is the tape. It's a cotton strip.
Okay.
This is how it is.
Okay.
So it's what you can stretch it. So like for example, I can break the anchors and then you can stretch it.
Oh, okay, wow.
Okay, so it's an elastic tape with an acrylic adhesive.
Okay. Does it come in different colors?
Yes, it comes in various colors. We have pink, we have blue, we have black, so many colors.
Okay. Okay. So once you've done that, then how long does it take for somebody to recover, and can they still play sports with the tape on and things like that?
Yes, you can play sports or whatever you are doing. You can walk around with it. It doesn't affect anything. You can also bath by having the tape on. So taking a shower, you can still keep it on. The only thing that will temper with the tape is excessive sweat. So when you sweat too much, it will just let the tape come off. The tape can stay on for about 3 to 5 days, sometimes even longer. It depends on how clean you keep it.
So after that, you need to come back and for you to redo it?
Yes. So we normally do the taping as when we realize that there's been an improvement. But most cases, there is always an improvement with the taping because it also, resolves some of the issues for them. Some of the issues ranging from tissue problems or inflammation and all that stuff.
Okay. So then moving from the shoulder down the body to the knee. Me personally, I've had some knee issues in the past. But what kind of thing do people come in with, and how do you treat that?
Okay, so with the knee, people have what we call ACL, anterior cruciate ligament. It's normally if it's a sprain, then we can do the taping. But if it's excessive tear, total tear, then that means that the patient might need surgery.
Okay.
So we advise on checking and see if it's something that we can do to help the patient. But as I said, if it's just a sprain, then we can take the...
And then what are the other things that can go wrong?
Okay, so the other things that can go wrong is maybe we taping the person and realizing that it's not what the patient actually needs. So we take into consideration if it's something that will really help the patient. So if not, then we stick to what we still adjust the knee anyway. We mobilize the knee. We sometimes do some stretches on the knee to help the patient get better.
Okay. Okay, so Dr. Michael, let's break the shoulder down a little bit. You mentioned about some other injuries that we can have. So can you go in a bit further?
Okay, so we can have what we call the frozen shoulder, which is also known as adhesive capsulitis. So
say again.
It's also known as adhesive capsulitis. So what happens is that the inner sort of capsules in the joint, in the inner capsules thickens and then they become tighter. So it causes, there will be some stiffness, some pain in there. Most cases there will be an inflammation.
Is it like scar tissue, something like that?
Yes, okay. Similar to that, yeah. So what happens is that these kind of conditions normally affect people with hormonal imbalances. Sometimes they affect people with immune system weaknesses. It can also have, most cases affect people with diabetes, who are diabetics, because they found it, who haven't immobilized their arms for a long time. It can affect them. And what happens is that they are unable to move their hands to various positions. There's loss of range of motion in the arms, and then they can't even do anything. They can't lift their arms up. They can't walk. Whatever positions they put their arms, they feel pain. When it happens that way, we have to sort of mobilize the limbs. Now, mobilizing the limbs is just like we doing some kind of stretches. Okay, so the techniques that we use here in Nova, we use a wide range of techniques. We can also use that for older people, and that sort of condition normally affects older people.
Okay. And then what are the other injuries that can also happen?
You can also have what we call the TOS, thoracic outlet syndrome. So this is when your hands become numb. So people will feel some numbness in the fingers. They will also have some pain in the neck, the shoulder area, radiating down the arm in this position. And then what happens that the nerve here, which is the upper part of the chest, is compressed here or is impinged. So it can also be impinged, similar to when you're having lower back pain. You can also have some impingement at the lower back, and then the pain will radiate through the legs. That's what we call the sciatica. The same way you can also have it in here, and we call it the TOS. It's the upper part of the chest.
You mentioned earlier about the chiropractic adjustment. I thought or assumed it was just for the back, but you can do it for if you have an injury, another injury.
So chiropractic actually focuses on the spine, but we also mobilize the limb. So for example, we can mobilize your shoulder. First of all, if you have a shoulder pain, we mobilize the shoulder to see and then stretch the shoulder. If we realize that is not what you need, we do the taping. We can also mobilize the knee. We can also do some adjustment on the knee, the ankles, and even your head as well. So it depends.
Okay. So I've come in and doctor, my knee is hurting me.
Yes.
What do? I was playing football and then all of a sudden I heard a. Okay. What happened?
So we will attribute it to maybe if there's any anterior cruciate ligament tear, and we have to assess it to see if it's really torn totally. And if not, then we can also do what we call the physio on. We can mobilize the knee, and then after that we can do some taping.
Okay, so what happens in the physio?
In the physio, we do what we call the electrical muscle stimulation. Okay. And we also have the chiropractic assistant that will help to mobilize the knee to strengthen it up as well.
Okay. And then and the same thing with the shoulder?
Yes. So with the shoulder, first of all, we will go through the core of the treatment, which is chiropractic. After we've done an adjustment, we will mobilize the shoulder. And if we mobilize the shoulder and realize that the shoulder is taking a time to heal, is then that we tape the shoulder.
Okay. So, I'm getting this view that chiropractic is not just for, I'm old, my back is hurting me, or something like that. It can be for others as well, younger
Yes.
people?
Yeah, so chiropractic ranges from babies to young adults, throughout all the ages to older people. Okay, and at the same time here we look at people with sport injuries. So we don't. It's not limited to a particular group of people, but a wide range of the population.
Okay, so as an athlete, I want you to give advice to those who are regular sports players. What should they do to avoid? I know you want them to come to you, but what should they do to avoid coming to you?
Right. Okay. So this is what I'll tell them. See, when people are sort of training to get to perform this kind of sport they do, what they normally don't do is that after the training they don't stretch off. So you have some of them, for example, your hamstring becomes tighter enough, and then you get a muscle pulls, and they begin to be frequent. So I like to tell them they have to be stretching off every now and then before and after the activity, before and after the sports. They should also do some mobilizing the limbs. So like you can have your friend mobilizing yours, you mobilizing his as well, just to loosen it up gradually a little bit, and that will help. You can also take some warm bath as well to help it as well, to just relax the muscles.
Okay, so that's a more muscular advice. What about, is there anything one can do for the bones?
Right, with the bones, similarly to the kind of injuries that you get, you also need to stretch up the bones. So there's various exercises or stretches that you can do at your own pace in the house. You can stretch your neck, by holding your head down in this position, and then to the other side. You can also stretch the side of the muscle here, the shoulder muscle, by turning your hand towards this direction, and then turn your head to the opposite side. Same thing with the knee, same thing with the ankles, and you can even mobilize the toes as well by somebody wiggling and pulling it out. Okay.
Dr. Michael, thank you so much for your time. I'm really grateful.
Thank you.
That has been me, Nanama and Abempong, on Health Check today. We've been talking about athletic injuries. We will see you again next week. Thanks for watching.